Hello, week 4 lecture is chapter 42 on stress and adaptation. The objectives of this lecture is to explain the physical and emotional responses to stress, describe the short-term and long-term effects of stress, discuss the nurse's responsibility in teaching a client about activities which will decrease the risk for developing an illness as a result of stress, discuss the grief process and the stages of dying, develop a plan of nursing care for the dying patient and family, and to explain the nurse's responsibilities to the patient after death. The basic concepts of stress. Stress, by definition, is a condition in which the human system responds to changes in what is considered its normal balanced state. Stress results from a change in the environment that is perceived as a challenge, a threat, or an immediate danger. The major sources of stress in our society arise from interpersonal relationships and performance demands rather than from actual physical um, threats. So, stress, that's a response to changes in our normal balanced state. So, in other words, the changes like when we talk about people having like a homeostasis state, a stressor is a change in that particular state. Okay. Uh, two, stressor. A stressor is anything that is perceived as challenging. It may be internal or it may be external. It can be threatening or demanding. Stressors can be internal or external. A hormonal change or fear is what may be considered internal. An example of external stressor could be a loud noise or a cold temperature. As with stress, the perception and effects of the stressor are highly individualized. Stressors themselves are neither positive nor negative, but they can have positive or negative effects as the person responds to change. Adaptation. Adaptation is considered a change that takes place as a result of a stressor. When a person is in a threatening situation, immediate responses may occur. Those responses, which are often involuntary, are called coping responses. The change that takes place as a result of the response to a stressor is what a person would call an adaptation. Adaptation is to some degree an ongoing process as a person strives to maintain balance in his or her internal or external environments. Adaptation also occurs in families and in groups. Adaptation is necessary for normal growth and development. The ability to tolerate changing situations and the ability to respond to physical and emotional stressors. Homeostasis. Homeostasis. Our bodies are always interacting with the constantly changing environment. The environment includes the external environment as well as the internal environment, which includes the mechanisms that, regulate the body functions. To maintain health, the body's internal environment must remain in a balanced state. Various physiological mechanisms within the body respond to internal changes to maintain relative constancy in the internal environment. This is what is called homeostasis. A balance is achieved when the perception of the stressful event is realistic and support and coping mechanisms are adequate. As you can see on slide 4, um, when you on the purple little box is what the stressor is, and then on the right side you can see where the sources for support and the coping mechanisms, which are the yellow squares, or enough to keep from the stressor from weighing down that particular person. An imbalance occurs during a stressful event. So here you can see where perception of stressor, which is that large lavender box, and then you have the sources for support and the coping mechanisms, which are smaller. So there you can see where the stressor weighs down because the number of sources for support in the coping mechanisms isn't enough. So an imbalance can occur if the perception of the event is exaggerated, or if sources for support or coping mechanisms may be considered inadequate. Physiologic homeostasis. Okay, we'll talk about what they call the local adaptation syndrome, which involves only one specific body part. Remember that the local adaptation syndrome only involves one specific body part. So the LAS is a localized response of the body to stress. It involves only a specific body part, such as a tissue and or organ, instead of the whole body. The stress that precipitates the LAS may be traumatic, or it may be pathologic. LAS is primarily homeostatic short-term adaptive response. Although the body has many localized stress responses, the two most common responses that influence nursing care are the reflex pain response and the inflammatory response. So, the reflex pain response is basically like, for instance, if something hits you and you it's painful, it's when you jerk away or you pull your hand back, for instance, like if it's a burn. The inflammatory response is just your response, um, like with the white blood cells trying to attack maybe an injury or an infection, or when you swell as a result. That's called the inflammatory response. General adaptation syndrome. The general adaptation syndrome is a biochemical model of stress developed by Hans Selye in 1976. The GAS, or GAS, which is the general adaptation syndrome, describes the body's general response to stress, a concept essential in all areas of nursing care. The three stages in the GAS are the alarm reaction, stage of resistance, and stage of exhaustion. So first we'll discuss the alarm reaction. The alarm reaction, which is the first stage of the GAS, or the general adaptation syndrome, is the autonomic nervous system, which initiates the flight response, preparing the body to either fight off the stressor or to run away from it. However, this is most often not in a literal sense. A person perceives the stressor and the defense mechanisms are activated. So then you have what I just discussed, which is the fight or flight response. The hormone levels rise and the body prepares to react. Then you have what they call the shock and counter shock phases. So basically, The alarm reaction called the shock phase is characterized by you'll have these type of symptoms. You'll have an increase in energy level. You'll have oxygen intake increases, cardio output, blood pressure, and also people become more alert mentally. During the second phase, which is the phase of resistance, having perceived the threat and mobilize its resources, the body now attempts to adapt to the stressor. So the vital signs, the hormone levels, and the energy production return to normal. If the stress can be managed or confined to a small area, which is the LAS or local adaptation syndrome, the body regains homeostasis. If the damage to the body is too great, with severe injury and or bleeding or a major illness such as cancer, the adaptive mechanism generally fails. Then the last phase would be the phase of exhaustion. Exhaustion, it results when the adaptive mechanisms are exhausted. Without defense against the stressor, the body may either rest and mobilize its defenses to return to normal or reach total exhaustion and die. Psychological homeostasis. Psychological homeostasis is to maintain mental well being. Humans also must maintain psychological homeostasis. As discussed in your book in chapter 4, each person needs to feel loved and a sense of belonging, to feel safe and secure, and to have what they call self esteem needs. When these needs are not met or a threat to need fulfillment occurs, homeostasis measures in the form of coping or defense mechanisms help return the person to emotional balance. Everyone frequently encounters physical, psychological, and or social change in their internal and external environments. A person's perception of these changes may be conscious and or unconscious. If the person has the necessary resources, adaptation takes place and balance is maintained. If the resources cannot reestablish balance, a state of stress results. The person's responses and the degree of stress depend in part on the nature, intensity, timing, number, and duration of the stressors. Adaptation to stress also depends on a person's age, development level, what types of things like past experiences have occurred, any type of support systems, and coping mechanism. See the focus on the older adult box for age related effects. Adaptive response includes the mind and body interaction, anxiety, and coping defense mechanisms. Psychological homeostasis, emotional responses to um, stress. Um, Individuals may suffer from depression. They may also suffer from anger, anxiety, which is usually the most common. There are four various types of anxiety. You have what they call the mild, which is present in day-to-day living, and that could be just a normal type of anxiety. For instance, someone is a little anxious prior to taking an exam. And then you have what they call moderate, which is where an individual basically focuses on um, what their immediate concerns are, and they don't attend to other communication and or details about what that is. And that may be where an individual have maybe butterflies in the stomach and a slight increase in their respirations and pulse. Then you have what they consider severe anxiety, which is when a person tends to have a very narrow focus on a specific detail, and it causes all behavior to be geared toward getting relief. It is manifested usually by difficulty verbally communicating, increased motor activity, a fearful facial expression. Sometimes people will have headache, nausea, dizziness, tachycardia, and hyperventilation. Then lastly is panic, which is loss of control and experiences dread and or terror. Um, and panic is usually manifested by difficulty communicating verbally, agitation, trembling, poor motor control, sensory changes, sweating, and tachycardia. Sometimes people have hyperventilation, shortness of breath, palpitations. Sometimes they may even say they have a choking sensation or chest pain or pressure. The person at that point is really pretty much unable to learn, concentrates only on the present situation, and often experiences feelings of impending doom. This level of anxiety can lead to exhaustion and or death. Psychological homeostasis behaviors used a lot of times that people use generally to decrease distress level would be crying, laughing, sleeping, cursing. Sometimes people use physical activity and exercise. You may often see people smoke, um, drink alcohol. Sometimes people have a lack of eye contact, withdrawal from individuals, limiting relationship to those with similar values and or interests also would occur. Okay, then you have lastly what they call task-oriented reactions to stress, which one would be the attack behavior. Lastly, like I said, withdrawal behavior, which we discussed already. And then, of course, more logical would be compromising type behavior. Okay. Then we have a brief little film on this slideshow, um, which basically just briefly describes how stressful it can be to be a nurse and shows how one may uh, deal with the stressors.
Good morning, Mrs. Jones. How are you today? Oh, where are your clothes?
I seem to have pulled my IV out. I am nauseated and in pain. My entire body is itching. I also just fell out of my bed onto my face.
Oh my. Oh great. I am getting 2 admissions. Oh, now I also have to get 2 patients ready for surgery. Now another patient needs help to the bathroom, and management doesn't think we need aides, so I have to do it myself. We are understaffed, so I have not been able to go to the bathroom for the past 8 hours and have not had time to eat or drink anything all shift. Now Dr. Johnson is at the nurse's station waiting for me so he can chew me out. Good grief. The patient in room 301 is coding. I'm sorry, Mrs. Jones. I have an emergency I need to attend to.
Do you have any OxyContin? My skin burns and my face hurts.
I have to go.
I am hungry. Can I have a sandwich? And ginger ale? Oh no, I was just incontinent in my bladder. And my bowels. I think I am about to have a seizure. My blood pressure is dropping.
Okay, now that we're finished looking at the short video, we're going to talk about various defense mechanisms that individuals use in order to deal with stressors. And these are defense mechanisms that they use on a daily when they are dealing with various situations. The first defense mechanism that we'll discuss is compensation. And basically, compensation um, is when an individual tends to overcome what they perceive as a weakness by emphasizing a more desirable trait that they feel that they have. Like, for instance, an individual may be like very, very smart, but then they may be very, very short, and let's say that they are um, they feel uncomfortable about the fact that they may be short, so they may tend to emphasize or overcompensate with, how they're like overachiever or something like that. Okay, then another is when a person is denial. And denial is primarily when a person just refuses to acknowledge the presence of a particular condition. Uh, Sometimes when you have ill people and that type of thing is going on, what they'll tend to do is go on and continuing on their life and doing various things. You see this a lot when you have terminally ill people, and they'll continue to go on like nothing basically is going on with that individual. Then you have what they call displacement, and that's when you transfer an emotional reaction from one person or object to another. The main way that I can describe that is by basically just saying that that was like the old thing when people used to say that, like, for instance, the boss yelled at the man, and then he came home and he yelled at his wife, and then the wife yelled at the kids, and then the kids kicked the dog. That's a example of displacement. Introjection. Introjection is when one incorporates qualities or values of another person basically into his own ego structure. Um, then you have what they call projection, is when, for instance, um, that's when whatever you're doing, you are attributing that act or whatever to someone else. Um, so basically, whatever thoughts or impulses that are going on within you, you attribute it to someone else. And then rationalization is when you try to logically explain something that you're doing, which may be like a socially acceptable explanation or for some type of behavior that's questionable. Like for instance, you're um late and you may be like, well, if it wasn't so busy on the freeway, then I wouldn't have never been, late or something like that. um Another one is reaction formation, where you develop conscious attitudes and behavior patterns that are opposite to what we would really like to do. Regression, you return to an earlier method of behavior. An example of that is, like, for instance, when they talk about how, like, if you have a one child and then a lot of the other children are getting, or you have a new child, and then that child might start waiting on themselves to get attention. And then repression is voluntarily excludes an anxiety producing event from a conscious awareness. So that's when you basically totally, because of the fact that maybe something bad had happened to you or whatever, you basically act like it never existed, and you go on like it never occurred rather than dealing with it. Sublimation is substitutes a socially acceptable goal for one whose normal channel of expression is blocked. And then the last one is like undoing, where an act or communication used to negate a previous act or communication. What I would like for you guys to do is for people to probably come up with examples of these particular defense mechanisms, and then we'll discuss them in class. Stress and health and illness. Health and illness continuum is affected by stress. Stress in a healthy person may promote health and prevent illness. Adaptation to acute and or chronic illnesses involves two adaptive tasks. You have what they call the general task, where people maintain self esteem and personal relationships. And then you have what they call the illness related task. And that's basically where a person is handling the pain and or disability. So, um, 21 is effects of the long-term stress on a person is a serious threat to either an or physical or emotional health. Like I said, it's very, very true that emotional health can affect physical status of a human being, and it increases the risk for disease and or injury. Also, stress compromises recovery and return to normal function, and it is associated with various diseases. Like for instance, you could talk about people who may have ulcers or various things like that that accumulated, or high blood pressure, and they may be related to increased stress levels. Family stressors, um, types of family stressors, or for instance related to people having changes in the family structure and or roles, like for instance someone losing a job, any type of anger and or feelings of helplessness and or guilt about something that occurred in the family, um, any type of loss of control over normal routines, maybe even deal due to illness, and a concern for future financial stability. And as we talked about this before in a previous lecture about a family stressor being the burden of caring for a family member. Crisis. Crisis is a disturbance caused by a precipitating event such as a perceived loss, threat of loss, or a challenge that is perceived as a threat to self. Um, I want you to know the difference between the types of crises, which maturational, that is when you have role changes, for instance, where you may at first have the parent that's in charge, and then you find where the children and are caring for maybe the parent in that way situation. No, it's just basically a change that happens, a life event, that takes a change that you may not know is going to occur at that particular time. And then adventitious, which is basically something that happens that's unexpected and it's accidental. All of these type of things can of course increase an individual's level of anxiety. um, you have sources of stress, which may include developmental stress, and this may occur when a person progresses through stages of growth and development. Of course, you have like an infant who is learning to maybe trust others, and then you have probably one of the most stressful times is when you have adolescents who are striving for independence. You have your situational stresses, and these basically occurs in predictable patterns. It occurs at any time, a illness or an accident or a marriage or a divorce. All of those type of things are individual situational sources of stressors. um you have types of stressors which are experienced, um, or can be physiologic, which have specific alteration in normal body structure and general stress response. So this could be related to any type of chemical agent, physical agent, uh, somebody having an infection, nutritional imbalances, some type of genetic or immune disorder, so any type of physiologic alteration and what a person would consider their normal body structure would be considered uh, physiological stressor. Psychosocial would include real perceived threats, which may include accidents, stressful or traumatic experiences, horrors of history, fear of aggression, and rapid changes in world. Personal factors is what is the level of importance of one's physiologic reserve and genetic inheritance. Ability to adapt decreased in certain populations. Some people handle stress and can adapt. Maybe they're more accustomed to having stressors in their life. People having adequate sleep and nutrition is very important on how they deal or cope with stress. And social factors and life events are implicated in what type of how they adapt to stress. Stressful activities in the nursing profession, like I showed you guys just a few minutes ago in the video. Um, one stressful thing could be if an individual assumes a responsibility for which one is not prepared. When you're working with an unqualified personnel, when you're working in an environment which supervisors are not supportive, or caring for a cardiac arrest or dying person, and then also when you may experience conflicts with your peers that you're working with. All of those can be considered stressful activities in the nursing profession. Nursing process, as far as assessing people for stress, you need to obtain Okay, through the nursing process, when you're assessing for a person that has to see if they're having stress, what you need to do is you need to obtain a thorough nursing history, identifying stresses and how a person perceives and copes with the stress. So you're looking at the things that's going on with that individual while you're obtaining that nursing history. You're going to do a physical assessment, and you're going to particularly be looking for things that exemplify stress, as far as maybe they have dysrhythmias, maybe they're saying they're having chest pains or headaches or hyperventilating. I'm having diarrhea. I got tense muscles. I'm breaking out in hives. All those type of things. Um, could show that a person is going through stress. So then, once you do that, you're in the process of diagnosing what could possibly be, the stress. So through your assessment data, it may reveal the stress and anxiety to be the problem, or it may, or whatever the etiology of nursing diagnosis. So then what you need to do is you need to plan afterwards a goal that could possibly decrease that person's anxiety, and ways that you can facilitate adaptation in the patient with that particular anxiety. Interventions that you may use to help patient decrease stress and to facilitate coping skills may include uh, interventions such as teaching healthy ADLs. You may encourage exercise, rest, and or sleep, and adequate nutrition, and also see if they have adequate support systems. Um, so relaxation, meditation, guidance, guided imagery, biofeedback, crisis interventions, all those are methods and ways that people generally deal with stressors. um, Providing crisis intervention, 5 steps thereof to problem solving techniques designed to promote a more adaptive outcome is to identify the problem. You want to list various alternatives, choose from those potential alternatives, implement the plan, and then, of course, you're going to evaluate the outcome. Uh, the patient should verbalize causes and effects of whatever the stress and anxiety may be, and the patient should be able to identify and use sources of support. A patient uses problem solving to find solution to the stressors. Patient practices healthy lifestyle habits and anxiety reducing techniques such as those exercise and that type of thing. And then the patient verbalizes decrease in anxiety and or increase in comfort. So those are the type of things that you would be looking for when you're evaluating the plan of care that you set for someone with stressor. So that is the end of the lecture for chapter 42, and we will be moving on to chapter 43, which would be loss, grief, and dying. Okay, the lecture is starting on chapter 43, Loss, Grief, and Dying. The objectives are to explain the purposes and types of health assessments, the follow guidelines for conducting a health history, prepare the patient and the environment for a health assessment. You will be identifying the equipment and positions used during a physical assessment, use the techniques of inspection, palpation, percussion, and auscultation during a physical assessment, conduct a physical assessment in a systematic manner, document significant health assessment findings in a concise, descriptive manner, and describe nursing responsibilities before, during, and after diagnostic procedures. You have types of loss. The types of loss would include actual loss. Actual loss is the kind of loss that can be recognized by others. Then you have what they call perceived loss, which is felt by a person but is intangible to others. Um, you have physical loss, which versus psychological loss, and then you have maturational loss, which is experienced as a result of natural development process. Situational loss, which is experienced as a result of an unpredictable event, and then anticipatory loss has not yet taken place, but you see this loss coming. Um, the definitions that we mainly want to discuss would be definitions such as grief. Grief would be emotion reaction to loss. Um, Bereavement is what we would consider a state of grieving, and the person goes through the grief reaction. Then you have what they call mourning. um, Mourning is when a person basically accepts the loss, but the person learns to deal with the loss. So, um, grief again is an internal emotional reaction to loss. It also occurs with the loss caused by separation as well as with the loss caused by death. For example, many people who divorce experience grief. Loss of a body part, a job, a house, or a pet may cause grief. When a person is mourning, the actions and expressions of that grief include the symptoms and, like the ceremonies, including a funeral or final celebration of life, that make up the outward expression of grief. And then people who are bereaved are in a state of grieving from loss of a loved one. So those, once again, uh, you have what they call angles. You have Engel's 6 stages of grief. First of Engel's 6 stages of grief is the first one would be the shock and the disbelief, and that is when you refuse to accept the fact that there is a loss, and it's followed by a stun or a numb, response. It's a total shock and disbelief. The second phase of Engel's 6 stages of grief is developing an awareness, and that's when the physical and or emotional responses people exemplify, such as anger, feeling empty, and or crying. Then you have the third phase, which involves rituals surrounding that particular loss. Um, let's start off with, like, for instance, you have, let's reiterate, you have that shock and disbelief, or you're usually defined as when a person is refusing to accept the fact that they have a loss, and then it's followed by stunned or numb feeling, or response, which where a person usually may say, no, not me, and then by a developing awareness, which is characterized by physical and or emotional responses such as anger, and then why me, feelings, and then restitution, which involves the ritual surrounding the loss. With death, it includes religious, cultural, or social expressions of mourning, which may be, like, for instance, a funeral service. Okay, so the fourth stage of the Ingalls 6 stages of grief is resolving the loss, and that involves dealing with the void that would it may be left by the loss. Then you have idealization, which is exaggeration of the good qualities that the person or the object had, followed by acceptance of the loss and a lessened need to focus on it. And then the outcome is the final resolution of the grief process, and it includes dealing with loss as a common life occurrence. Then You also have you have the Kubler-Ross's 5 stages of grief. Kubler and Ross's 5 stages of grief would include denial and or isolation. The patient denies that he or she will die or may repress what is discussed and may isolate himself or herself from reality. Then you have the second phase, which may be anger. Patient expresses rage and or hostility and adopts a why me attitude. The third phase of Kubler-Ross's 5 stages of grief is bargaining, where the patient tries to barter for more time. Some start to put personal affairs in order. Um, then you have stage 4, which is depression, and the patient goes through a period of grief before death, and a lot of times it's characterized by crying and not speaking much. And then the last phase would be the acceptance phase, where the patient feels tranquil and she or he has accepted death and is prepared to die. Here is a brief clip of um, of going through those particular stages of uh, grief, a brief clip.
Uh-oh. It's no big deal. It's probably not even quicksand. I'm gonna have a good laugh about this tonight with the guys. Well, this is just perfect. Stupid quicksand, stupid jungle. I wanna bite someone in the face. Mother. Ah! That stupid jungle. Are you there, God? It's me, Giraffe. Listen, if you would just give me a mulligan on this quicksand thing, I promise. No more peeing on your shorter creatures. What, you get a deal? You know something? I'm cool with this. I bet heaven has all the tender leaves I can eat, and everyone gets their own Slurpee machine. Yeah, take me, sweet death. I await your loving embrace. What? I think I hit the bottom.
Okay, dying and death. Dying may occur suddenly as a result of an accident, injury, and/or pathologic crisis of some sort, particularly maybe possibly a heart attack. It may occur after a prolonged experience with the debilitating disease process as well. 3 definitions of death. You have what they call the traditional heart lung, which is an irreversible cessation of spontaneous respiration and or circulation. Then you have what they call whole brain, which is irreversible cessation of all functions of the brain. And then you have higher brain, which is irreversible loss of all higher brain function. Other signs of impending death would include inability to swallow, pitting edema, decreased gastrointestinal and or urinary tract activity. Then They may have bowel and or bladder incontinence, loss of motion, sensation, reflexes, elevated temperature, cold or clammy skin, cyanosis, usually a lowered blood pressure, noisy or irregular respirations, and or Cheyne-Stokes respiration. Components of a good death. Um, a good death is one that allows a person to die on his or her own terms. It's relatively free of pain with dignity and is free from avoidable distress and suffering for patients, families, and or caregivers. In general, accord with patients' family wishes and reasonable consistent with clinical, cultural, and or ethical standards. The definition of a good death. These factors include control over symptoms, preparation for death, opportunity to have a sense of completion of one's life, and a good relationship with healthcare professionals. So they want it to be pain and symptom management. They also want you to be able to have the ability to have clear decision making, as well as um, a notable preparation for death, completion, contributing to others, and affirmation of the whole person. Terminal illness. Terminal illness in which death is expected within a limited space of time. Most patients want to know diagnosis and prognosis as soon as possible. There may be some cultural influences which may dictate how much information is desired and which family members are to be informed. How to break the news, sit face to face in private place, ask the patient what they know about the condition and or ask the patient how much they want to know, give information generally in small chunks, don't overwhelm the people with the information, and acknowledge any emotional reaction, summarize and or ask questions at the end. Palliative care. We've talked about that before, but I'm just going to go over it once again briefly. It means taking care of the whole person, uh, body, mind, spirit, heart, and soul. Give the patients the best quality of life they can have by the aggressive management of symptoms. So you want to have them to be pain free, is and be as comfortable as possible. Sometimes called hospice care. Hospice care focuses on needs of the dying. Palliative care is appropriate across the spectrum of diseases and illnesses. So it's not just centered on just dying. Palliative. Um, there are five basic principles to palliative care. Um, start principle number one would be respect goals, likes, and choices of the dying person and his loved ones. You want to look after the medical, emotional, social, and spiritual needs of the dying person. You want to support the needs of the family members. You want to help to gain access to needed healthcare providers and care settings, and you want to build ways to provide excellent care at the end of life. Advanced directives. Advanced directives decide who will make decisions for the patient in case he or she is unable. It decides the kind of medical treatment the patient wants or doesn't want. It decides how comfortable the patient wants to be, decides how the patient will be treated by others, and it also decides what the person wants loved ones to basically know. Under advance, there are two kinds of written advance directives, and they can minimize difficulties by allowing individuals to state in advance what their choices would be for healthcare. Um, there's a living will. which provides specific instructions about the kinds of health care that should be provided or foregone in particular situations, and then a durable power of attorney for health care, which appoints an agent the person trusts to make decisions in the event of subsequent incapacity. Special orders that are included in those advanced directives. Usually they have what they call a DNR, or do not resuscitate, or no code, which there should be no attempts or to be made to resuscitate a patient who stops breathing and or whose heart stops beating. One is comfort measures only, which basically the goal of this treatment is um, a comfortable, dignified death, and the future life sustaining measures are no longer indicated. So, and also do not hospitalize, where patients elect not to be hospitalized for further aggressive treatment and they choose to die at home. They also have terminal weaning, which means there's a gradual withdrawal of mechanical ventilation from a patient with a terminal illness or an irreversible condition with a poor prognosis. They have also what they call assisted suicide, where a clinician provides means that the patient used to cause her own death. Basically, what they do is they provide prescriptions for lethal doses of barbiturates. And then there's active euthanasia, where the clinician acts directly to cause death of patient, which means that that particular person administers the lethal dose of medication. Factors to consider. You need to consider a death certificate. The death certificate, the law requires completion of the death certificate with signature of the physician. The mortician generally assumes responsibility for handling and filing death certificates with proper authority. Then you may want to consider organ donation, and decision made by the patient or family of the deceased patient only. And then the nurse's role is just to notify the transplantation program, which in our case may be lifelink. um, Autopsy is basically the examination of the organs and tissues after death, and usually that gives them it confirms the reason for death. Factors affecting grief and dying. Of course, there's developmental considerations as far as grief, as opposed to where they come from, the age of the people involved. You have to take that into consideration. Family, any socioeconomic factors, any cultural influences. People may not react the same. Is gender. Is there any religious things that we need to go through? And the causes of death may play a role in uh, grief and or dying. Needs of dying patients. Physiologic needs include physical needs such as hygiene, pain control, and nutritional needs. Psychological needs may include patient needs control over fear of the unknown, pain, separation, leaving loved ones, loss of dignity, loss of control, unfinished business, and or isolation. And then sexual needs. Patient needs way to be physically intimate that meets needs of both partners. And then of course there's spiritual needs. Patient needs to practice religious faith if that's what their choice is. Nursing interventions. It's important as the nurse for you to develop a trusting nurse patient relationship, explain the patient's condition and or treatment, teach self-care and promoting self-esteem for the patient, and also teach the family members to participate and or to assist in care and meet the needs of the dying patient. You need to also make sure that the family needs would be met. Um, As far as providing postmortem care, once the person passes, if they're in the facility, you need to prepare body for discharge, which means that for them to come and pick the patient up, you need to place the body in what they consider an anatomical position. You need to replace dressings and remove all tubes unless there's an autopsy being scheduled. Place any identification tags on the body and follow local law if patient died of communicable disease that could be contagious. Okay, as far as the family is considered, you need to listen to the family's expressions of grief, loss, and or helplessness, and you always offer solace and support by being an attentive listener, and you need to arrange for family members to view the body in the case of sudden death and provide a private place for family to begin grieving. It is important for the nurse to attend the funeral and make a follow up visit to the family if at all possible. And then any care of other patients after death of one patient, nurse must continue to make sure that she provides care with her other patients, and the other patients in some instances may need to be consoled or have grief reactions and or have depression. Okay, that is the end of the lecture. If you have any questions, feel free to give me a call or contact me. Thank you and have a nice evening.